So this is what our Medicare Patrol, Senior Medicare Patrol Healthcare Fraud and Abuse Quiz will look like when you enter it from our website. So we have 17 questions, and I'm going to start the quiz so that you can have a sense of where we'll go with it. Okay, so first of all, when you get to the quiz, you will enter your name and your email address. Our first question is it is fraudulent for a durable medical equipment supplier to work with your physician to get the right documentation in place so that Medicare will approve your claim. Is this true, false, or it depends?
Do we have any brave volunteers who want to raise a hand? Linda, can you hear us?
Yeah, can you hear me?
Yes, absolutely. What's your answer?
Oh, I would say false.
All right, let's put it in here and find out. That is correct. The supplier is merely helping and is legally allowed to do so as long as the doctor reviews and signs the order. All right, we're on a roll. Number 2, fraud has occurred if your Medicare Summary Notice shows that Medicare has paid a claim to a doctor or practice that you do not recognize. Is this true, false, or maybe?
All right. We have, looks like a volunteer for the last question, but I'm going to pull you for this one. Mercy, are you there? Nope, no luck. Kathy, let's move it along.
Okay, so the answer to this question is maybe. So this may or may not be fraud. This may be a third-party provider that you did not have direct contact with, but provided services. So it's always best to inquire. Number 3, it is fraudulent to let someone else use your Medicare card to bill for services you did not receive. True, false?
Linda.
I'd say that's true.
That's right. It's absolutely true. It's always fraudulent to let someone else use your Medicare card to bill for services you didn't receive. Number 4, you see several claims for the same procedure on your Medicare Summary Notice, and Medicare has approved only one charge. You are sure your doctor is committing fraud or abuse by overbilling. Is this true, false, or maybe?
Let's see those hands. How about Carol?
False.
Let's see. Sorry. The correct answer is maybe. This may be due to bundled billing. Medicare may not approve some services that are listed on the MSN because it has included payment for that service under a different code. Your doctor is recommending that you have a lab test, but he or she believes that Medicare will not cover the charges. Your provider can require you to sign a form before providing the test, saying you will pay if Medicare does not. True, false, or maybe?
Look at all the volunteers. Angel, I think you were first in.
True.
Correct. That's right. This is the legal notice called the Advanced Beneficiary Notice of Non-Coverage. The purpose is to let you know that Medicare may not cover the service. And then when you're going through these slides, you'll also see that we provide additional information on some of these questions, so more resources for you. You receive a bill for much higher charges than you believe are valid. Obviously, your doctor is committing fraud or abuse. True, false, or maybe?
Angel again, very brave.
I'll say maybe.
Yeah, maybe. Let's see. Correct. That's right. This may be due to a billing error. Contact the doctor's billing office and make sure they have billed all of your insurances correctly before you pay. It is only fraud if the provider knowingly altered the claim forms to obtain a higher payment amount. Medicare Advantage plans are allowed to contact potential members directly for marketing purposes without a request from the beneficiary. True, false, or maybe?
All right, so let's go to Carol. Carol?
False.
That's right. Unsolicited marketing is not allowed to individuals who are not enrolled in the Medicare Advantage plan. Again, more information on this subject. Medicare Part D plans are allowed to offer drugs for $0 copay if you agree to use a specific pharmacy. True, false, or maybe?
One volunteer. Carol again.
True.
Correct. Plans can contract with individual pharmacies to set pricing. Medicare Advantage plans or their representatives can make unsolicited calls to Medicare beneficiaries enrolled in their plans. True, false, or maybe?
How about Linda again?
True.
Correct. Generally, plans may contact their members. However, there are guidelines that must be followed. Number 10, it is fraudulent for a home health agency to continue to bill Medicare for physical therapy when the beneficiary is no longer improving. True, false, or maybe?
Natalie?
I would say maybe.
Ooh, I'd be curious to know why you would say maybe.
Well, can you guys hear me well?
Yes.
Yes, indeed.
Okay, perfect. I'm so excited. Well, I would say maybe because if they're no longer improving and like if they know that they're not going to improve and they're not going to do anything more for them, then, I mean, I don't know. That's what I think.
Okay, so that's a misconception, unfortunately, that a lot of people have. If you have, and I'll go on to the answer to share with you, and then we can chat a little bit more about it. So the answer is false. If physical therapy is necessary, or speech or occupational, necessary to maintain the individual's condition or slow decline, it is a Medicare-covered home health service. And I would also add to that that as long as someone has a necessary need for the service, that it is covered. That's something that we have continued to try to educate folks about because unfortunately there are many of the Medicare contractors and the agencies and the providers who do not know that someone can be covered. And I didn't mean to call you out. I just think it's a really important concept that we talk about. Okay, number 11. A home health agency can provide and be paid by Medicare for providing care 7 days a week to a homebound patient. True, false, or maybe?
Let's try Carol.
Maybe.
Okay. I think that's a reasonable answer. It says incorrect, but the maybe is in the part of in certain circumstances, indeed, that Medicare will provide care 7 days a week to a homebound patient, particularly as the coverage calls for within the first 21 days of services. So I agree with you there. I think we can go with maybe. And again, more information in the manuals, and here is the link for you if you'd like to read that more. Number 12, an in-network provider who does not participate in Medicaid can charge copays to Medicare Advantage plan members who are in the QMB program. True or false? Or maybe?
Carol is the only one brave enough to tackle this one.
False.
Correct. So it's considered balance billing and is prohibited even if the provider is not participating in Medicaid. And again, more information on balance billing through those links. Physical therapy is not allowed by Medicare when ordered for maintenance purposes only. True, false, or maybe?
Belinda?
I'd say false.
Okay, that's right. Medicare can cover physical therapy to maintain an individual's condition or slow deterioration if the skills of a physical therapist are needed. And again, more information on Medicare coverage of maintenance services. A Medicare beneficiary has been charged co-payments, co-insurance, and or deductibles for Medicare-covered home health services. This is fraud. True, false, or maybe?
Carol?
False.
Okay, so it's actually, I think, a maybe question, because if we're talking about Medicare Advantage plan, Medicare Advantage plans do have the ability to charge co-payments, co-insurance, and deductibles for home health services, again, depending on the plan. And you can find this by plugging in a person's zip code in and looking at what the Medicare Advantage plans that are offered within that person's region. But for the most part, if the Medicare beneficiary is a traditional Medicare beneficiary, in other words, has traditional Medicare and not a Medicare Advantage plan, there is no cost sharing for Medicare-covered home health care.
We can add that very important qualifying term after the webinar today.
Super. Observation status in the hospital is a fraudulent scheme which results in higher out-of-pocket expenses for beneficiaries. True, false, or maybe?
Carol again?
False.
Right. Unfortunately, observation status is allowed under the CMS policy. Something that the center is really digging deep into because of the unfairness of the policies. Medicare Advantage plans are required to issue explanation of benefits to all beneficiaries. True, false, or maybe?
How about Angel?
True.
So the correct response is false. Medicare Advantage plans do not have to send explanation of benefits to duly eligible beneficiaries. And then our final question, Medicare Advantage plan members may purchase a Medicare supplement, a Medigap plan, to help with out-of-pocket costs. True, false, or maybe?
How about Linda?
False.
That's right. It's not permitted to have a Medigap plan with a Medicare Advantage plan.